Spring is in the air and the garden is bursting with activity. The grass starts growing and the blossoms appear on the trees, but for some it's hay fever season with itchy eyes and runny nose. Just to add to their frustrations, those with hay fever may find that they develop surprising food allergies along with their sniffles. This is called pollen food syndrome and is also known as the oral allergy syndrome. It's possibly a bit more common than we think it is. About 20% of those in the UK are affected by hay fever at some point in their life, but 2% will also develop the pollen food allergy syndrome. Hello, my name is Dr. Yesudian and I'm a consultant dermatologist based in the UK. Today we will examine the oral allergy syndrome in more detail. First, let's look at what causes it. When somebody has hay fever, they have an IgE-mediated allergy, which means they produce increased amount of IgE, which is a normal antibody produced by our body. Normally, it's used to fight away parasitic infections like malaria. However, in some, there is overproduction of IgE, and this can predispose to the development of hay fever, which is triggered by various types of pollen. The problem is that some foods may have proteins that are very similar to those in pollen. When those with hay fever consume these foods, especially when they are raw, their bodies effectively think that they are ingesting the pollen and therefore develop an allergic reaction. The symptoms of oral allergy syndrome may vary from person to person and is possibly more common in women. Those with pollen food syndrome can expect swelling and itching inside the mouth, in the throat, and also in the ears and eyes. This will happen shortly after consuming the food. Some develop a bit of redness around the mouth and also a generalized urticaria or hives. For most people, the symptoms will be mild and will pass relatively quickly, usually within a few minutes or a couple of hours, particularly if they take an antihistaminic tablet. Rarely it can be very severe, causing difficulty in breathing and reduced blood pressure, and this is called anaphylaxis. Depending on what type of pollen you're allergic to, the food allergy also varies. It's usually to raw fruit, vegetables, legumes, and nuts. Those with tree pollen may cross-react with apples, coriander, kiwi, peach, and other fruit. Those with grass pollen may react to kiwi, melon, orange, and potato. And finally, those with wheat protein can have a reaction to apple, melon, orange, peach, tomatoes, and other fruit. If you're not sure what type of pollen you're allergic to, then the season in which we develop it may give us very good clues. If you get your symptoms from March to late May, it's likely to be tree pollen allergy. From May to July, it's grass pollen. And from June to September, it's wheat pollen allergy. Sometimes we can have an allergy to more than one type of pollen too. The diagnosis is made on clinical and laboratory methods and can be difficult when the history is not clear-cut. In those with hay fever or pollen allergy, the appearance of oral itching or tingling, particularly after eating fresh fruit or vegetables, is a good indicator of possible oral allergy syndrome. We can perform skin prick tests with extracts of pollen and fruit, although this is only done in some centers. Blood tests looking for specific pollen and fruit allergies, which is called RAST test to IgE, may also be helpful, provided there's a good history for it. If the tests are negative, an oral provocation test can also be considered. For this, the person consumes the suspected food and then the onset of symptoms is recorded. Please note that there are many commercially available tests that claim to diagnose food allergies, but this is completely to be avoided because they have no scientific basis at all. They can be harmful because multiple food can be excluded without any reason. How do we manage this condition? Avoidance of the inducing food item is probably the best option. However, if the food is cooked or if it's canned, many of the allergic proteins are destroyed and therefore the person may be able to consume them. Oral antihistaminics may be taken for mild symptoms and are usually quite effective. Those with severe reactions may require an injection of epinephrine, which is available as EpiPen injections that they can carry with them. Desensitization with immunotherapy may also be helpful for those with very severe symptoms. If the person accidentally consumes the food that causes the allergy, try to rinse the mouth with plain water. Having a hot beverage may inactivate the residual allergen. Antihistaminics may also be taken, and the results of the symptoms usually settle in about 30 to 40 minutes. In conclusion, oral allergy or pollen food syndrome may be a condition that we easily miss. If anyone with asthma, hay fever, or allergic rhinitis reports symptoms of tingling in the mouth associated with or without a rash, then consider this entity and take the management steps that have been mentioned earlier. I hope you found this information helpful. Thank you for listening, and bye.